my friends. So I wanted to make this video just so people kind of understand. Almost every time I do a presentation or an event at a local high school, college, business fair, whatever the case is, I normally get the same exact questions, which is, hey, I love the presentation, but I have specific question about something that I am kind of doubting with or unsure about. Could you help? Right? And we do. We have private coaching programs, which are different from our workshops. Remember, the workshops are done for like a professional, just like general setting, kind of giving a brief overview of what to expect, how to expect it, all that stuff. But for these actual coaching sessions, I wanted to make this video because this is kind of how it looks, right? So in this specific case, this coaching session, um, what I did was I was helping a student who was thinking about going into the nursing slash medical field. Now, here's how this works. And again, this is what I tell you guys, the coaching session normally takes longer. It's not just so straightforward. But in this coaching session, she had told me that she wanted some kind of like medicine career helping kids. But she didn't want to go to med school and be 4 years of undergraduate, 4 years of med school plus residency. She just didn't want to do that. She wanted to know, is there anything else she could do? So again, I told her, listen, here's a common program that a lot of people do, might be interested in, right? And it's becoming a pediatric nurse practitioner. So that caught her attention. And she wanted to know more about it. So here's kind of what we did. So I'm going to give you guys the kind of the breakdown of what it would take to become a nurse practitioner and why this is one of the jobs that when students talk to me about, I really do like it. And I understand that this job has become really saturated after the pandemic, right? A lot of nurses who are working bedside don't want to be bedside no more. They kind of jumped into this NP space, and some are having a hard time finding jobs. I've even talked to nurses that tell me that they're making the same amount of money as an NP versus bedside nursing. So again, like it really does depend on your individual goals. There is no one career path that's gonna be like, this is the one. I'm rich now, right? But it does help for you to start thinking about this. So for this student, here's kind of a path I laid out for her because this student, she didn't want to take on a lot of student loan debt. Her parents weren't aren't wealthy, right? So they're really not gonna be able to help her that much. Um, she's kind of paying her way through school. So I told her, like, oh, listen, you're at Miami-Dade College already. Miami-Dade College offers the nursing degree to become a registered nurse. Now, the way nursing works is before, years ago, you could become a nurse even through a certificate program. That was kind of done away with. And now the minimum to become a nurse is to get your AS degree, meaning your associate in science, as a registered nurse. Once you finish that degree, you then can sit for the exam, which is called the NCLEX, and then you can get your nursing license and you can start working right away, right? So there's not many jobs out there that with a 2 year degree, you can start working and making pretty good money, right? Now, as everything, here's something else. A lot of hospitals now are requiring their nurses to have bachelor's degrees in nursing. However, they will hire you with the associates with the condition that within, maybe 2 or 3 years, you get that bachelor's degrees. But some employers will even pay for you go get that degree. So here's what we did for this student, right? I said, listen, you started MDC, right? And we even broke down her courses for her. So again, this is a pretty aggressive schedule. I mean, would I recommend it to everybody? No, but again, you gotta know what your goals are, how much time you want to spend. So she told me, she's like, look, I want to be in to this program as fast as possible. What's the least amount of time? I'm like, all right, look, these are the courses that you need. And again, guys, all I'm doing is going online, right? You could do everything I do here. All you gotta do is the difference is I know where to look, but I'm teaching you where to look so you can go look at these things and verify. My ultimate goal here is remember, every school you go to, you have amazing advisors who are willing to help you out always. But remember, these are people, humans that have a job. They make mistakes sometimes. They're the same way as great advisors, maybe one or two bad ones. I've had a couple of students tell me they've been stuck with bad advisors. Listen, maybe just the student wasn't asking the correct questions, right? So, like, the whole point is that you guys learn how to figure all these things out. So, when you go meet with your advisor, like, hey, Mr. or Mrs. Advisor, here's what I'm going to do. Here's the classes I need. How does this look to you, right? Now you can get real feedback. Not just show and be like, I think I want to do nursing. I think I want to like if you come in like that with that attitude, no one's gonna want to help you, right? Remember, at this point, you're already in college. You're at least 18 years old, right? You're an adult. At a certain point, we stop babying you, even though I am technically babying you, but I'm not babying you. I'm teaching you a skill set, right? So if you come here to the nursing program and you open this file up, they tell you the classes that you need, right? Your ENC 1101, your philosophy, and then down here, you can see, I'll zoom in a little bit. These are the courses that you need. These are considered your nursing prereqs. So when you apply to the nursing program, what they do is they take these courses and they figure out like your science GPA based on anatomy 1 and 2 with the lab, chemistry, and microbiology. You also have to take a test, the TEAS, which I'll show you guys that later, right? So this student, here's how we planned her semester out. Notice, it's pretty aggressive. She's taking English, she's taking a math. Now, I always put MAT 1033 because realistically, a lot of students at Miami-Dade College end up having to take that math course because their math scores need a little bit of help or their math skills, right? So, but if you scored high enough, you can skip MAT and jump straight into MAC 1105. However, like I said, I'm assuming that you just need a little bit of help, a little bit of love, right? So, you got English, you got math, you got your American government, federal government class. Remember, this class is a requirement now. You have to take that class and pass the Florida Civics Literacy Examination. Now, unless you took AP in high school or you took Cambridge and you passed it there, then you're good. But if you didn't, you got to pass this. And if you are going to Miami-Dade College or anywhere you're going to, make sure the school you're going to has the record of you passing that test. I had a student this semester telling me that, oh yeah, I passed it in high school, but didn't transfer over, so I'm retaking it again. I told her to go talk to admissions, advising. I don't think she really did, but whatever the case is, right? And then here's your first science course for high school, Anatomy and Physiology 1, right? So notice fall, spring, you're doing another batch. Again, pretty difficult schedule, right? Mac, anatomy, chemistry, right? And in the summer, the microbiology, the philosophy, the computers, the speech, and then you can apply for the following spring semester. So this is a pretty heavy duty schedule. Maybe she could probably like submit her application and just like knock one more class out in the fall. But again, she wanted in and out, guys. So again, everyone's schedule will be different. That's why I tell you guys, coaching sessions are individualized sessions because everyone is different, right? But once this student is ready for the courses, we come here to back to MDC nursing page. You go to the requirements. They literally tell you here, guys, how to apply to the program. They tell you to contact the medical campus advisors, right? So let's say you're taking classes at West Campus, Kendall Campus, Hialeah, where the case is. You still need to go to the medical campus or at least email the advisors there because they're the ones who get you into a nursing program. So you request a milestone review. Again, everything is here, guys. There's no excuse, right? They tell you about when to apply. If you want to start fall, right? You got to apply by February the earliest, round 3 the latest. If you want spring, right? They tell you here are different options they have. So for all of you folks that are watching this, you're probably a full-time student, a young person, little to no responsibilities. The generic full-time, which means you're in school full-time, is probably your best option, right? You have multiple options. Now, if you're working, you're an adult, you have other responsibilities, and you want the part-time option, that also exists too, right? You do classes at nighttime and the evenings, weekends, and whatnot. But just keep that in mind. And then down here it tells you like the more requirements, that intro class you got to take, right? The TEAS exam that you got to complete, and your cumulative GPA, science GPA, and TEAS is how they put you on a ranking list for nursing school. So assuming you do great in all this and boom, you are now heading into nursing school, right? Once you're there, you will complete these nursing classes that are part of the nursing program. And once you finish this, you are now eligible to sit for the NCLEX examination. Notice right here, right? Once you have this, boom, you start working, you get a job at a local hospital. Now, you got a job local hospital, and now you're like, all right, I need to get my bachelor's degree. MDC offers this, but let's say you want to go to FIU. I'm using FIU as an example. There are what's called RN to BSN programs. Miami-Dade has it, FIU has it. For here, I'm using the FIU example. But all this means is this is a program in which you're working as a full-time nurse already. Like you're in a hospital working. But then online, you're completing your nursing classes that you need to get your bachelor's degree in nursing, your BSN. And normally, a lot of hospitals will end up paying for you to do this, some kind of tuition reimbursement. Now, to be fair, guys, obviously you know this, or you should know this. If a hospital gives you money to go to school, they're doing so because they expect that once you graduate, you're going to work for them. And then normally, if you end up leaving that job, there is stuff in your contract that you got to pay that money back. So just keep that in mind whenever you're considering any programs paying for your money, right? There's also like military programs if you want to go into the military. If you're a nurse and you commission to the military, you commission as an officer, right? You're not enlisted, you're an officer, which, pretty good. It's a great program if that's what you want to do, right? This is what I'm telling you guys. These coaching sessions are individualized because everyone's goals will be different, right? And then here's really quick what I was talking about. I'm using Baptist Hospital as an example, but again, there's other options available. It doesn't have to be Baptist, but notice Baptist Hospital here in Miami, they have an undergraduate nurse scholars program and they have a graduate nurse scholar, which means that for your undergraduate, which would be like Miami-Dade College, BFIU, right? If you come here, you see the schools, right? Notice Miami-Dade College is eligible, right? Your bachelor's science. So again, and if you, the RN to BSN, notice it has 3 little asterisks. If you scroll down here, it tells you MDC RN to BSN program is for employees only. So if you're an employee of Baptist Hospital with an RN degree and you go through Miami-Dade College, they will pay for it, right? So again, doesn't gotta be Baptist. I know Broward Health has similar programs. So look for a bunch of free programs. I mean, obviously, that's what we do in a coaching session. But I mean, now with ChatGPT or AI, you can just kind of ask it to search for you, tell it, act as my college advisor, and it'll pull stuff up for you, right, guys? And then I told the student, let's say once you finish your bachelor's degree and now you're working, this would be the next step, right? Now, there's also, you guys, the nurse practitioner program. Obviously, I'm using FIU as an example, but there's other schools that offer this program. It's not just FIU, but I'm using FIU because it's right here, right? So FIU offers master's degrees and nurse practitioners, and they offer doctoral degrees. Now, I've heard rumors, I've read some stuff online that the master's degree nurse practitioners are kind of like being phased out, and the DNPs will be the future. But for right now, masters are still there. They're still an option. So for the student, I said, listen, here is what you were talking about. You wanted to work with children in a pediatric capacity, similar to a doctor, but not really a doctor. So here's an option, right? And if you look at it, you have right here, pediatric primary care nurse practitioner. Now, with this program, if you've been working as an RN, already making money, you were working during your BSN, already making money, and now if the hospital you're working at is offering it, you can get your master's degree paid for by your hospital you're currently working at. And within 2 or 3 years, you are now a pediatric primary nurse practitioner. As a nurse practitioner, I mean, you could see patients. So for example, if you ever go to some of these like urgent care centers or even some of these like pediatric associates type medical facilities, sometimes there's medical doctors, but you'll occasionally find there's NPs, right? Or PAs. So PAs are the physician assistants and the NPs are nurse practitioners. Now, I'm not gonna go into this video about the differences. Maybe I'll do a later video. But again, if If you just go to ChatGPT or you just Google online, you can see the main differences. And really, as a nurse practitioner, you can almost do anything that a primary care doctor does. You can see patients, prescribe medications, right? I mean, you can do surgery, and there's always some like caps here and there, depending on where you live and where you want to practice and what they hire you for. But normally, like if you see yourself working like in a pediatric, clinic, seeing children, helping kids, with just general things, this would be a great option for you. And the pay here, you know, it could start as low as $90,000. I've seen some as high as $150,000. Now, like I mentioned, because right now here in South Florida, there's so many nurse practitioners, there isn't that many job opens, and the ones that are open are paying less. So I've had like former students of mine that have done this option, and they've told me they're making about like between 115 to 125 is what I've been hearing, right? And it's not really here. Some have left up to like Orlando, to the West Coast, like North Florida, just because up there the demand is still there, right? While down here it might just be oversaturate the market. So again, that's something you got to consider too as well, right? Where you want to live as well. So I hope you found this helpful. So again, notice for your RN program, let's say you're going to Miami-Dade College and you apply for this Baptist scholarship, you get your nursing school paid for free and then have a job right when you graduate. Then you're working, let's say at Baptist, right? And maybe they offer to pay for your RN to BSN, or maybe you're already working, so you pay for your own degree. But then they offer to pay for your master's degree. So again, like you have all these different options. So you could literally within what, 2 years for your associates, a year and a half, 2 years for your bachelor, that's four, and then 2, 3 years for your master's, anywhere from 6 to 7 years. And because you've been working this whole time and you got some scholarships, your student loan debt is probably like little to nothing, if anything. And you've been working, making money, and you're in the healthcare field, right? You didn't have to go to med school. You didn't have to take out 200, 300 grand student loans, which again, if that's what you want to do, I mean, do that, right? I tell all students, I go, listen, you're young. If you want to be in the medical field and you want to be a doctor, don't let the time stop you, right? I know right now thinking, oh my God, 12 years, 15 years of like schooling, training, residency, all that stuff. It seems like a long time. Well, my friends, you're going to be 35 anyways. Like it's going to happen for you regardless. Might as well be 35 and be a doctor, which you really wanted, than be 35 and be a nurse, which you didn't really want. And then now you regret your choice later on, right? Like I'm a firm believer in living my life with no regrets, right? Because the worst thing you want to do is not try something or not do it. You think it might be too long, too hard, too expensive. And then you realize, oh man, I could have, should have done it. Especially as you get older, you gain perspective on life, right? Like I know when you're 20 years old, like 35 seems like forever. But then you're 35, and you're like, damn, I should have done that, right? Or you get to the field and you realize I really wanted this instead. And again, at 35, you could go back to med school. Why not? But again, like don't let time stop you. Don't, I mean, obviously there's financial concerns, right? But again, if you really want something, create a plan, get with a mentor, get with an advisor. If you don't have any of those things, reach out to us. That's what we do. And create a plan which you can set the goals that you want. So I hope you found this helpful. And if you did, you know the whole routine, guys. Subscribe, like the video, share it with somebody you think might benefit from this video, right? And if you want to reach out to us, send us an email, right? If you haven't done so yet, check out our website, right? This is our website. You go on our website, you can contact us, you can see what we do, you can book appointments with us, you can follow on social media, right? Advising the Way on Instagram, right? We're there. Anything you guys need for us, feel free to reach out. And as always, we appreciate you. Have a good day, guys.